Hi, everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Tracy Stein. As always, I am happy and I am grateful to be here with you. Now, this week's episode is actually an encore presentation of an interview I did with Dr. Anthony P. Bossis. Dr. Bossis, or Tony as his friends call him, is a researcher and clinician in private practice and affiliated with Bellevue Hospital, NYU Medical Center. Tony and his colleagues have been doing research and clinical work for several years now, looking at the impact of psilocybin on the well-being of patients who are diagnosed with a serious illness or terminal illness or going through the dying process. Now, psilocybin, for those of you who are not familiar with the term, is a type of psychedelic that is derived from mushrooms, but used very carefully under supervision and in appropriate doses. What it actually does is it can help people who, again, are dealing with very serious or life-threatening illness or imminently about to die to find greater peace and ease, reconnect with feelings of love, remember a sense of purpose and reconnect to that, and lose a lot of the fear and anxiety that come, again, with dealing with illness. Now, I think this is more timely than ever. In the last few years, we have dealt with an incredibly serious pandemic with significant loss of life and a lot of people who are dealing with other health problems that some of them they were dealing with before the pandemic and some worsened since the pandemic. Some are new illnesses since then. We're still really learning about what that's going to mean for all of us going forward. But in this country, I don't personally think that we do a great job of talking with and supporting people who are dealing with serious illness, who are dealing with thinking about their own mortality. And look, it's really understandable. These are hard topics to talk about. But you may even find that your healthcare providers shy away from the topic because it's just something that's hard and uncomfortable for all of us to sit with. If we don't learn how to not only help people by being able to talk with them throughout this process, but offer them something to alleviate a lot of the very expectable but really challenging anxiety that comes with this, what we can wind up doing inadvertently is increasing their feelings of isolation, worsening their already present anxiety, feelings of depression and fear. So I think this is a conversation absolutely worth having, absolutely worth playing again. You'll find a link also to Tony's TED Talk in the show notes. And on my other podcast with my friend and co-host, Kathy Kelly, on Curious Explorers, even though that delves off into a lot of other very different subjects, I did interview someone named Sean McNamara, who has done a lot of research into and published on and learned about careful clinical use of psychedelics for a variety of things. If you have confusion about this topic, though, this episode with Tony Bossis is the one to listen to. Unfortunately, I don't have a video, so it will be all on audio only. So hi, everyone, and welcome again to another episode of Unpacking Possibility. I'm your host, Tracy Stein, and today I think you are going to be riveted by our esteemed guest, who is a good friend of mine and will feel like a good friend of yours by the time we're done, Dr. Anthony P. Bossis. I'm going to read a little bit of his formal bio, but you're going to hear right from Dr. Bossis himself about his incredible journey, his incredible work. And I'm just going to mouse over here. So Anthony P. Bossis, PhD, is a clinical psychologist and clinical assistant professor of psychiatry at NYU School of Medicine, the NYU Center of Psychedelic Medicine, and an adjunct professor of classics and religious studies at the University of Ottawa. Since 2009, he's been conducting FDA-approved clinical research with the psychedelic compound psilocybin, and he'll tell you more about that today. Dr. Bossis was director of palliative care research and co-principal investigator on the landmark 2016 clinical trial, demonstrating a significant reduction in emotional distress from a single psilocybin session in people with cancer, specifically a rapid decrease in depression, anxiety, hopelessness, and demoralization, along with improvements in spiritual well-being and quality of life. It's really amazing. He's the study director and lead therapist on an FDA-approved clinical trial investigating a psilocybin-generated mystical experience with religious leaders. And I'm going to let Tony, as I know him, I will let Tony tell you more about his journey. But first, Tony, I wanted to welcome you and say thank you again for taking time out of your busy schedule to be here with me today.
This is great. I am looking forward to this, Tracy. We're going to have a great conversation. Thank you. Thank you for having me.
Oh, I'm so glad to have you here. So I have a million questions for you. I'm going to try and pare them down. But one thing, maybe even before we start, is I just want to let people know we're going to talk about everything from the intersection of spirituality and psychology, which is becoming more and more a focus of psychology research, and that's a good thing. We're going to talk about psilocybin and what it is. I'm going to let you explain that. Mysticism and really the importance of helping people to die better. So I'm going to let you take it from there.
Well, there's a lot there. There's more than that. I look forward to our conversation. Yeah, you touched some of the big themes, and we can get into these bit by bit. But I've been really lucky to be working with psilocybin, this compound you mentioned, for a number of years, for about 15 years already, and people are calling this the psychedelic renaissance. I'm not sure I like the labels, but I would call it a reemergence. I think a renaissance, we could safely say, when it's fully incorporated and integrated as a therapeutic tool in our healthcare system and in the culture. But we're getting there. It's been an exciting time. And there's a lot to talk about. The study you referenced is, let me back up, I guess, a minute and talk about how we don't die too well. Right. One of my taglines is we don't die well in America. I will say we're getting better. Palliative care, as you know, and hospice over the past 10, 15, 20 years have made really enormous gain. I always think of Ernest Becker's book, The Denial of Death. It really is the ultimate taboo, talking about death and our death and breaking news, we're going to die someday. But we all kind of push that away as if it doesn't apply to us. So my background is in palliative care, and we really have a kind of a paucity of tools to work with the anxiety, right? I mean, for being your career in healthcare, we've gotten better at chemotherapies, better at pain management. We're getting, we're improving our care for a variety of cancer spectrum and other disorders, but that emotional, existential, spiritual distress, suffering that can accompany the end of this incredible journey we have here for a few years is really hard to treat. There are some meaning-making psychotherapies out of Sloan Kettering and elsewhere to address those feelings, but they're hard. They're hard to get at, right? This research that we'll talk about has been shown now in research going back 50 years to that first exciting wave of psychedelic research that I want to talk about. I think you and your audience will get a kick out of it. It's a rich period. And then there was a 30-year gap because of all the 1960s, the kind of countercultural issues that President Nixon had enough of. And these drugs were legal back then, by the way. They were legal for the culture. They were used in psychoanalysis and psychotherapy. In 1970, President Nixon made the medicines for the culture out of reach: LSD, psilocybin, mescaline, and I'll define those in a moment. But more sadly and more tragically, he stopped the research. And until that point, there was really a growing body of literature with peer-reviewed and research working with these medicines with people who had terminal cancer and also alcoholism. And there was a 30-year gap. And now we're in this kind of incredible moment where there's hosts of studies going on, FDA clinical trials, with a host of clinical indications that we'll talk about. And the one I'm primarily interested in is helping us, how do we apply this to the end-of-life distress? And I could discuss those results in a few minutes. But I want to start by saying the dovetail to this entire conversation is, as you know, this current zeitgeist we're in. I mean, this it feels like an inflection point. And I think what it's done, I hope what it's done, and all of us hope what it's done, in addition to all the incredible, unspeakable suffering that we're all going through and people have gone through, that hopefully it pulls the curtain back and reminds us this is fleeting, this is impermanent, this is suffering and death are right there. And it's kind of an existential wake-up call. I think for the planet, like a Dharma lesson for the planet, to quote the Buddhists, it really, what are we doing? What are we doing about how we die, how we live? I look forward to getting into this all with you, but I'll allow you to ask the next question. But it's really a very interesting time in the culture, and that these medicines come back at this time is really exciting.
It really is. And, for people who are listening who maybe aren't as connected to healthcare as you are and as I have been in the past, I just want to define a few things. That palliative care we're talking about when we are providing services and medicines to help people be more comfortable, but they're not therapies, they're curative. Right. And so people with certain chronic illnesses or illnesses we would classify as terminal, sometimes we get to a point where that is what we're offering. Now we're shifting to comfort care, reducing anxiety, and helping people find meaning and acceptance. Right. And that's something a lot of people, I think, don't really understand or aren't as familiar with as an area of medicine until a loved one maybe is diagnosed with something very serious, or until they themselves are. And so, yeah.
I was going to say, and meaning making, we'll come back to in a minute. I want to tweak that a bit, so we're clear with the audience. Palliative care is the discipline that really covers the entire trajectory, even from diagnosis of a life-threatening disease, potentially as one, but that could be ultimately healed. It covers the entire spectrum of services: medical, pain management, spiritual, along the entire trajectory of a disease. Hospice is that very last section of time where there is rarely a cure, obviously. But sadly enough, as you know, people, doctors call palliative care teams in the last minute, and we wish they called us earlier when there was ample time to work with the patient, maybe for years during their diagnostic, journey. But yeah, it's something we don't think enough about. And the good news is we're seeing, these best-selling books out, and death duels and death over dinner and death, all these. There's an incredible awareness now and a cultural conversation that is so heartening. There's tons of organizations and websites and podcasts and events dedicated to end of life. And that's remarkable. Are we getting more comfortable finally with death as not somehow some different end of life? It's part of life, and it's a great teacher if we could just allow ourselves to think about it a bit while we're alive.
Such a great point. Because you're right, most people don't want to think about it. And, I have to say, and this is not to take a swipe at healthcare providers who are already dealing with so much, especially in the current era, but I would say most healthcare providers are not adequately trained in either pain management or palliative care or in psychosocial interventions.
Not at all. I mean, when I show I have some slides. I show that I cut out op-eds along the years. Now they're like 15 years old already. That say the biggest, the hardest conversation in medicine, the biggest taboo, that they weren't part of medical school training. Again, things are improved, but unfortunately, and I'm not criticizing oncologists at all, because I work with them, and it's an incredible discipline. But I think it's natural for a lot of people who work with patients at the end of life. They also want to avoid the conversation because there is that impulse to push this away and keep trying for more heroic efforts to extend life by a few more weeks. And that's fine to extend life, of course. But we want to extend that. We also want to devote ourselves to the enhancing the quality of life, right? And that is part of life. So, but things are improving. But it's and these last 2 years have been just incredible. I mean, right? Just really. And then we have this medicine. So which has been shown to be really effective, Tracy, in
Psilocybin.
treating that. Yeah. So just a quick backdrop, because for those in the audience who may not be aware of it, it's a really incredible history that got me involved with this 40 years ago. When I was in my 20s, this gave away my age there.
You don't look it at all.
Oh boy, oh boy. Um, I came across this incredible body of literature, like many of us did of a certain age. Um, and people like Aldous Huxley and Alan Watts in this incredible rich period of the 1950s and 60s. But there was a large body of literature emerging of using LSD with people with terminal cancer. Um, and greats like Humphrey Osmond, who maybe people don't recognize, but he was one of the leading pioneers. Aldous Huxley, the great English writer who wrote Brave New World and all that, was kind of like a godfather for this research, writing about these experiences forming like the mystical core of all the world religions. He wrote The Doors of Perception, which is based on his mescaline experience, done in serious ways. And we'll talk about how people took this medicine, not for kicks, but for this incredible potential glimpse into this mystical experience. And for about 10 years or longer, actually 15 years, they were doing university-based research, administering LSD in a one-time episode, and I'll discuss the treatment model in a moment, to people with terminal cancer. And the results were just striking. Their emotional, not to treat the cancer, but their emotional distress and very severe suffering was profoundly mitigated. And, the day after the session, after that 3-4 hour, a little longer with LSD, experience in that mystical peak state that we'll get into. And that's remarkable. And we kind of stand upon the shoulders of those great pioneers. By the way, the other indication to come out of the first wave of research was for alcoholism. And what some may not know, Bill Wilson, who's the founder of Alcoholics Anonymous, had done many LSD experiences. And his model for understanding how he worked with alcoholism in the 12-step program of spiritual being a higher power came to him in part through those LSD, those mystical experiences. So that's interesting as well. Yeah.
I knew that. I think most people would know that. I mean, most people who've gone through AA probably would not know that the founder actually had such transformative experiences from using psychedelics. Before we go further, just because I don't want to take for granted that people know what we're talking about when you say psychedelics and psilocybin, can you break that down?
Yep. Excuse me. So, psilocybin is a compound, a psychoactive compound that's found in many species of mushrooms that grows on the earth. The street language, magic mushrooms people have heard of, and that's what they are. But psilocybin is that ingredient within the mushroom that when humans take that medicine, can produce this really many experiences, but one of them is this mystical peak experience. And that's defined. We actually have a measure that defines that and measures that in patients going back 60 years now. One of the key features of that is, and let me backstep a minute. The mystical experience that I'm going to define is not unique to medicine, to psilocybin. LSD was another chemical discovered in the 1930s that also was a psychedelic, a mind-altering substance, as was mescaline. The experience it seemed to provoke, to generate, is an experience that we seem wired for. And that's what I always want to kind of get across whenever I speak about this. Humans are wired for meaning, for transcendent experiences. And these experiences are known throughout the history of humanity and form, most experts believe, scholars, the foundations of the major religions. At the foundations of all these beautiful religions is this mystical core, this sense of transcendence, unity, forgiveness, compassion. And so that when these experiences were first monitored in these trials, they realized this is just like the naturally occurring experiences we see throughout time that have occurred. Indigenous cultures use these medicines for centuries, for millennia. We think these medicines were used in ancient Greece at the Eleusinian mysteries outside of Athens. Plato, we believe, participated in these mystery schools. So the mystical experience is a subjective sense of transcendence, transcending time and space, as crazy as that sounds, transcending this body as we know it, connecting with something much more enduring. And for the person who's dying of cancer, Tracy, or anything, and soon whose body will begin to fail. This body will stop working in a week, in a month, in a year. That thought, of course, is terrorizing, can be terrorizing, because I am my body. This transcendent experience, people tell us this who are dying, who are dying, and some are still sick and with us, allow them to see self as something more enduring maybe than the body itself. I'm not my body. I'm not just my cancer. There's something more enduring about self or soul or consciousness. Consciousness is more complicated than just maybe brain generated experience. Maybe it's somehow outside of biology. We don't know as scientists. Um, and that's an incredible experience to have for them. It pulls the lens back, so to speak, on experience, and they see themselves in a much larger panoramic framework. And it questions the assumptions of the body, of death, of and other key features are unity, a subjective sense that we're all connected. Literally, everything is just interconnected, which of course is religious scripture as well, right? Uh, we see a sense of sacredness, profound feelings of awe, humility, and wonder. We see a feature called the noetic quality, a term coined by the great William James, 1901, that one is encountering like ultimate reality. In the hundreds of cases we've done, it's rarely said that someone says, "Oh, that was a drug effect. That was great. 30 minutes of this incredible, transcendent, magical experience." But that's just a drug effect. Rather, what we hear is, "No, that was more real than this. That was ultimate reality. That's important. That's who we are." Um, and another feature is ineffability. It's hard to describe in language, but people do a great job of writing their journal entries. So, in a nutshell, these medicines now will work in psilocybin um, in a very controlled setting. So there's preparation where we get to meet the patient, screen them carefully, prepare them for the session in terms of giving recommendations how to go into the altered state of consciousness. And the main recommendation is to trust your experience. Go with the unfolding changes in conscious, like you would in Vipassana meditation. Go into the changes. The person lays on a couch, wears headphones and eye shades to encourage a descent inward, right, into the experience. And there are two therapists there just watching them, being with them in case they need us. But for the most part, they're guided into this inward experience to explore, be curious, and to follow the unfolding changes in awareness. And we can come back to all that. Then there's a few week period of integration or therapeutically addressing what happened and how to make sense of it if they need that. And then going forward. The 2016 published results we did with Johns Hopkins showed incredibly, after one dose, a dramatic reduction in depression, anxiety, demoralization, which is a horrible experience, hopelessness, and dramatic improvements in spiritual well-being and quality of life after the one session. And that continues for the end of the study for 9 months. And then almost in a 4.5-year follow-up, the ones who are still living, many have passed away, still reported that those changes, and it was one of the most important experiences of their lifetime. So it's really incredible, some of the findings.
I was so struck by that. And I've seen your TED Talk, and I've seen some clips of some interviews of patients who have gone through these trials. I've been struck so much at how the fear of death, which is so universally present for people who are diagnosed with a serious or terminal illness, just seems to go away. And everything seems to have more meaning. And just the fact that one session, even 4.5 years later, for those who were alive, I just want to restate what you just said. Most people still still have those benefits. They're less anxious, they're less depressed, they find more meaning, they're not afraid. And I noticed something in one of the papers, the feeling of forgiveness is so much more prominent. I was so struck by that. I'm wondering, self-forgiveness as well, or more just forgiveness of others, or both?
Both. And this, people are asking everywhere now, how do these medicines work? And people speak about some of the biological mechanisms that make the brain shift consciousness. But what's working in the end is the experience. And it touches on something beyond just science, right? And as you know, science and spirituality weren't always separate avenues. The spirituality and the science used to be one human impulse. Where are we? What is this? And sadly, 4 centuries ago, they began to kind of separate. Now we see this division of the science and the sacred. Hopefully, they're coming together in an effort. And this research is kind of a marriage of those two fields. And we see this stuff written, of course, throughout our wisdom traditions. Yeah, what's striking to me, and all of us doing this, despite all the wonderful clinical reductions we're talking about, in the end, what people speak about so often is love and forgiveness. And to answer your question, yeah, loving kindness towards self, which is amazing because we're all falling short all the time throughout our lifetime. And, if it's the end of your life or anywhere in your life journey, to allow that self-forgiveness, self-love, loving kindness towards others and forgiveness. And we've heard incredible stories of people forgiving 50 years ago being raped or assaulted by someone. I mean, awful traumas at the hands of others. And of course, when you carry that around for a lifetime, it's harmful to yourself. And then there's this incredible sense of forgiveness. And part of that occurs in this, again, it's a bit ineffable, but this transcendent, mystical state where they see even what led that person to that moment. They see the influences affecting all of us in this unfolding thing we call life. And then what I like to talk about as a proud Greek American is kind of a greater love as well, agape, this kind of that this is all love. The ground of being, to quote Paul Tillich or paraphrase Paul Tillich, is is one of love. So that's stunning stuff to hear all the time, Tracy, and it has value. I mean, some people, some of my peers, and me as well, sometimes you'll hear us say things like this experience can be important for the survival of the species, not the drugs per se. These aren't really drug studies per se. It's about this experience that we're wired for that occurs naturally as well in different ways. But if we're all connected, literally, how do we hurt one another? If these values are incorporated into the human condition. So not to get too woo-woo on everyone here, but
that this is the place for it.
Good. Here we are in this incredible time, and now these medicines reemerge in medicine, and maybe we can incorporate them into the culture at some point. Isn't that interesting? And why are we worried for meaning? That's above my pay grade, but why would we have these experiences? It does seem to speak to something. Why are we worried for transcendent, meaning-making, loving states? What is consciousness? And we don't know. Is it generated by brain, or is it something more complex? Scientists don't know. And can these medicines be even used as tools in kind of trying to maybe get a peek into what that is?
So it's so fascinating, and I'm glad you mentioned that the times we find ourselves in. I cannot. I've said this before. I can't remember another time when people have been so divided, when we've all been so on edge. I never in my lifetime thought we would see this. It feels like a regression, not progression in any way. Not in a healthy way, and how needed, especially now. It's so needed to connect to personal meaning and the sense of connectedness to each other and something greater. And wouldn't the whole world be better if more of us experience this? Can you talk a little bit about how other ways that people can access this kind of this state of transcendence and meaning? Because you mentioned that it happens, outside of psilocybin as well.
Exactly. And I want to just refer to what you just said, respond to what you just said. It would be amazing if humanity on a whole recognized these values. But I don't want to, I don't want to come across as saying psychedelics is the way to that, right? I mean, these are in clinical trials and it isn't for everyone. And we'll talk in a bit about it. They're also very difficult. These experiences can be very challenging as we encounter the self or all that is consciousness or parts of it. However, yes, the values that these generate, which is the foundations of our great religions and all that, of course, that's what the world needs to realize, that we are all connected. And the pandemic showed us that in a pretty dark way. We're connected. We're literally connected. We can love one another or we can kill one another even through a virus. We're connected. So, yeah, the remarkable thing is that this mystical experience has been written about for millennia. Um, those features, unity, transcendence, ineffability, sacredness, um, are found in naturally occurring experiences. And those we see throughout time in terms of mystics, in Meister Eckhart, and pick any religion, Rumi, they're all speaking a language that these participants in our trials speak like, because that seems to be the experience of that. So they occur natural with those mystics and saints, um, and a recent Pew study show you'll like this. A Pew study on this topic showed 49% of Americans report having peak or mystical experiences in everyday life, glimpses. Not a 4 hour, tremendously altered state like this, where it's really dramatic. And we can come back to that in a minute. But glimpses, we all do, right? As kids, little peak experiences in the woods, feeling the sense of transcendence, being in love, jogging. People, athletes speak about it. Meditation, of course, mindfulness, prayer, um, naturally occurring just by grace. Richard Buck, a great Canadian psychiatrist, a century ago had a natural experience and wrote a beautiful book called Cosmic Consciousness. Abraham Maslow, the great American psychologist who wrote about these experiences beautifully. He was what he would call a natural peaker. He didn't do psychedelics, so they wrote about them, but he would naturally have these altered states, and some people have them more than others. But it seems religion was an effort to connect to that ineffable experience. And there were sacred technologies, right? Prayer, dance, meditation that could get at that. So again, we're wired for these experiences. These medicines seem to generate it in a pretty reliable way when done properly. And I want to just, I guess, make sure I say this part. So about 2/3 of our patients in all the trials have this peak mystical experience, as I defined it. This very dramatic, transcendent state that can be very difficult as well, very challenging. Um, Other states that it generates are also kind of, we try to characterize them as kind of autobiographical, like dynamically oriented, revisiting past life events, revisiting unresolved relationship problems, traumas, and that's profoundly helpful. There's studies going on with MDMA and PTSD. MDMA isn't a classic psychedelic, but it's a cousin of it, so to speak. And we're seeing great results with veterans out of the Iraq War and with awful PTSD, how a few sessions embedded within a psychotherapeutic framework is allowed to reduce the feel for response in the brain as they revisit the experience. And we're showing incredible results with that as they connect to the experience and relive it in a more a healing way. We're seeing indications for depression, eating disorders, smoking cessation, end of life, of course. So the indications are very growing, and yeah, this is part of who we are. And so meditate, mindfulness, all these things can give glimpses into this our essence. So who are we, Tracy? You know who we are. What is this? What is our essence? Our birthright, right? What is this?
You're making me think of something. It's probably about 25 or 30 years ago now. But just to your point about practices we can do that can facilitate connection with something, this transcendence. And this is very simple. I was doing probably 8 minutes of yoga in the morning. That's what I felt like I had time for. And I was doing a videotape. So that tells you a little bit about my age. And I was meditating. And again, I wasn't doing hours and hours of meditation. I was doing what a normal person couldn't fit into a day. And then one day I was walking home from the train, and I know that to you, this will make sense. But as I recall it, I see myself from outside. I can see myself as if I'm watching myself walk to my apartment at the time. And I remember this state of just feeling gratitude and bliss. It just came over me. And it was one of the most beautiful feelings I've ever had. I wasn't doing anything other than walking home from the train. It lasted a few minutes, but it made me feel connected to something much larger than myself in a way that was more than intellectual.
That was it. I mean, and I'll ask you a question. You'll confirm this. Right now, as we sit here, you can feel that feeling. That's still affecting you, correct?
A little bit. I mean, I feel a little bit, you can see that I've been kind of wiping at my eyes as you're talking about these experiences and talking about the need for us to have a greater sense of connection and also just working with patients who are dealing with very difficult existential issues.
You had a peak experience, clearly, and the memory of that stays 30 years later. And that was naturally occurring. You didn't take any LSD on the way home.
Not that I know of.
um, it's incredible, and there's a lot. It's a fun time because there's documentaries coming out and more books coming out about this. Like, what is consciousness? Why would it do that? Why would nature wire us for these experiences when you have them for 10 seconds or for 3 hours of incredible equanimity, acceptance? No matter what's happening, it's okay, which we hear a lot of. So these are people with cancer. And what we hear a lot of is that despite my disease, and despite that I will die soon, and despite the suffering of this world around us, there's a message, and this is hard to communicate, but that it's all okay. This is the way it unfolds. The great Aldous Huxley, who I quote all the time, in a letter to Thomas Merton, the great Christian mystic, Merton asked him, why do you write about psychedelics and mystical experience? What is that about? And Merton was a mystic, by the way, naturally, without drugs. And Huxley says to him very poignantly, which we hear a lot from our patients, that the experience showed him that despite the suffering, and he uses the word evil, which is interesting, despite the evil and the hardship of living in this material world, this life we have, the experience you get, the message you get is that it's all okay. It's already all okay. Not all it'll be okay. It's already all okay. And that in the end, it's love. God is love, he says in the end of this quote. But that's remarkable. And it speaks to some kind of naturally healing mechanism of consciousness. And why would that be? The guidance we give these patients. So to go a little more into detail, weeks of training, weeks of screening, for the trial. We get to know them well, which is crucial. We develop trust and rapport that defends against any like bad trip, as a street word, bad experiences. Then during the experience, they're encouraged to go into the changes no matter what happens. If death appears, if something dark and menacing appears, go into it. Literally ask it, why are you here in my mind? How do I learn from this? And by moving into these changes, it changes usually to a teachable insight, and eventually even through very dark experiences that can be could shake them. We see a lot of it leads to this sense of acceptance and of sometimes this sense of love and greater sense of well-being. And why would that be? Why would consciousness naturally do that? I asked that rhetorically, but it's incredible. Then there's weeks of integration. So, yeah, and now we're seeing it in a host of different indications. And again, this is not kids play. There's a lot of people not doing this outside of trials. And, I think people need to be careful because there are psychological risks. Medically, psilocybin is relatively safe. It does increase blood pressure and heart rate, and we monitor that. But psychologically, if you're not prepared and the dose isn't right, and you have maybe some coexisting disorders or challenges, it can be a very harrowing experience and not be so healing. It can be quite, it could arouse a lot of uncertainty. So that's why we have this incredibly careful and safe model that we use.
I'm glad you bring that up because when you were talking about LSD before, I think even as a kid, I remember hearing like, oh, you should never try this because, the infamous bad trip. And again, what you're saying is in your studies between the preparation and the monitoring and the dosing and the support during and after, it creates a safer and better experience. Tony, I'm wondering if there is and if not, if we can't say that's fine, but I'm wondering if there is a specific example of someone who was doing really poorly and really anxious or really just not coping well, who had a very dramatic shift. I don't know if there's a specific case that comes to mind that you could talk about.
Yeah, no, there's many. I should have. Something that I use quotes from these patients. Maybe I'll run and get one before we stop, and you can edit it and put it in later. Uh, but there's, they write journals about their experience, and they're very touching. Um, yeah, there are many. I'm thinking of one now who's been written about publicly. He was in his wife spoke to Michael Pollan in that very best-selling book. His name was Patrick. I got to know him well. He passed away a year after the trial. Very young guy in his 50s. So you're older than 50 when you call that you're very young. He had an awful cancer of the bile ducts. Very, very, very tough journey he had. And what brought him into the trial was, of course, this anxiety and distress about end of life, leaving his wife. This incredible thing we have here for a brief time. And he had a remarkable experience, as many do. I could describe his a bit. He wrote beautifully about, it's funny. When he took the medicine, so at 9 a.m. he takes the psilocybin pill. He lies down, headphones playing, a 6-hour track of kind of classical music as a backdrop just to avoid distraction of this consensus reality. Eye shades to encourage going into the experience. There are 2 therapists there at all times, just watching, and if they need reassurance, we're there to hold their hand and reassure them they're safe. And there's no talking for the first 2 hours, and usually there's no talking at all for the most part if things go well, and they just have the experience. And that night and the next day and for weeks, we could talk about it. He says, birth and death is a lot of work, and he's with tears coming down his face. And then for hours, he wasn't talking, but was having a very clearly moving experience. And he spoke about incredible waves of love, like we talked about. That love he had a wonderful life. He was, he owned restaurants. He was a musician. He was a well-known journalist. He really incredible guy. And, but the answer he kept getting was that love is what matters, despite all these material things we develop. He also took a tour of his lungs, he said, which is not uncommon. He saw the inside of his body during this altered state, and saw the tumors. At that point, he had metastases to his, and he was told, without a voice telling him, yeah, that's there, and your body's beginning to fail, but that's not so important. The important thing is love, and and on and one like that. He also had what's kind of remarkable. Everyone doesn't have this, but some do. Like a death rebirth experience. So this sense of like almost ego death, where everything who we are, Tracy Stein, psychologist, person, human, woman, wife, they begin to fade away. These attachments, right? Then what's left? And there's a sense of ego death that could happen, and then a sense of rebirth into this new perspective. And he had this in a very powerful way, and it's been written about a fair amount. It gets a lot of press these days too. And it's interesting because even that metaphor that is written about in the great religions, right? There's a great quote in Greece at one of the great monasteries over going back 1,000 years. Above the door, it says, "If you die before you die, then you won't die when you die." And clearly that's implying if you have this death rebirth experience while you're living, you're then fully prepared to live, and that's what maybe being born again is. And there's so many death rebirth experiences. All the religions have this example of death rebirth, and he had that, and it was quite touching. It's hard to speak about it any more than that because it's very moving. But when he came out, he was less anxious. He was less depressed about his death, which was only a year away. His wife, who was so lovely, Lisa, we spoke after that, and she even mentioned, I'm worried it went so well, he may not want to keep fighting the cancer. And it wasn't the case, as you know, from people that near-death experiences, which is very similar. So naturally occurring near-death experiences, people who have in an operating room, his heart stops and they're brought back minutes later, report a similar experience. Again, why? And I assured him, and then Patrick, we all spoke, and it wasn't the case. The opposite happened. After that experience, he was more accepting of his end. He had quite a touching end of life, but he wanted to have every milk every ounce of this existence he had left. He didn't want to leave early. He now was fully equipped to be in the present, and not be so terrorized by what's coming next week or next month. And that's remarkable. And there's many like that. Just people coming to terms with this and seeing it as part of the unfolding changes of this existence, but really experiencing it, kind of to use Buddhist language, maybe kind of uncoupling the attachments to this material realm and to the body, and there's something more, maybe not, but surrendering to some mystery. And all of this is incredible to speak as a scientist about this, which is like theology, right? But it's science. I mean, we hope this will be rescheduled within 5 years to treat people who are dying. Can we incorporate these therapeutic techniques in licensed, credible, trained therapeutic environments in hospitals, in private settings, in centers? And that's the hope, that probably within 5 years, if all goes well with safety and efficacy, these medicines can be used with an increasing kind of array of disorders: end of life, depression, anxiety, PTSD. So it's remarkable. But also we have to be careful. I mean, we're doing really great science, looking at safety and efficacy to control how to use these most appropriately.
So incredible, Tony. And I'm aware of a million questions I want to ask you. I'm going to tailor my list down because I want to be mindful of your time. But related to the research you've just described, if I understand correctly, you are now doing research with religious leaders, and they're finding out more about their experiences on psilocybin. I'm wondering if you can talk a little bit more about that.
So I should have. So the soft answer is no, but I'll explain why.
Okay.
I should have said to you before we started. So that trial is interesting. It's a trial looking at administering psilocybin to leaders of various religions, and we're not published yet, and so everything's under wraps. And we publish that, you will certainly hear about it.
You'll come back.
I'll come back for sure. Essentially, without getting into the study itself, but the details are public as well. We're doing it. Listen, these experiences seem to be of a spiritual nature, or you could use any. Religion happens to have spent the entire evolution of religion trying to describe these experiences, and so why not bring in religious leaders? People from the various traditions, priests and rabbis and imams and Buddhists, to have the experience themselves and see how they describe it with their very, specific and enhanced sense of the vernacular and this is their life dedicated to about these experiences. So we're not public with that yet, so I can't talk about results yet. But
okay,
we're about 6 months away, and it's I think we think it'll be important. Again, what is that? Why are we worried for these experiences? And, Albert Einstein famously said, religion without science is lame, science without religion is blind. That's a spiritual language to describe it, but we don't have to use that language. It just seems to be who we are. But religion happens to be a discipline, field that, of course, over the centuries, describes it in their own way through frameworks and parables. And how do you describe the ineffable? So how do you describe this essence of who we might be, what this is all about? And religion, of course, has been doing that, but maybe science can now also, and the scientific and the sacred can kind of merge in this incredible time, as you said earlier, to what are we doing here? What is this? And then in a more clinical way, how can we treatment refractory disorders, which are hard to treat? And real quick, there's a Hopkins trial with smoking cessation, tobacco, and they had one psilocybin dose, maybe two, embedded within a brief psychotherapeutic frame, which is always kind of this therapeutic package. The smoking, the quit rates were far greater than anything any one approach has done, patches or pills, or because they had these incredible experiences. Why am I doing this to my body? My body is sacred. They'd have tours of their lungs and see the damage they're doing. And so it's really endless not endless, but there are many indications. And NYU is soon going to publish a paper on, Dr. Michael Bogenschutz is leading this study with alcoholics. So We'll see. It's an exciting time for the research.
So interesting. So fascinating and so important. I'm thinking back to what you said earlier about other issues that either people are investigating using psilocybin with, or that might be an area that we should explore, like eating disorders, which can be incredibly difficult to treat, like I'm thinking phobias, things that are just harder to work with, and they're harder for the people who are dealing with them. I'm just, chronic pain, certainly.
Yep. There'll be a study on that soon.
Wonderful. I have a question that I don't know if your research has looked at, and it's just occurring to me. I'm just, I used to be somebody who believed erroneously that everyone was capable of empathy. And we know that a very small subset of the population does not maybe have that capacity, right? Um, correct me if I'm wrong, but I'm thinking when we talk about people who are more sociopathic, um, I'm wondering if psilocybin would change that for
Great,
them.
great question. There was a study done back in the early '60s, the Concord study with prisoners. Uh, it was the first study, and it was more to be done. So promising results, and there are people now trying to revisit that. It's an interesting question, right? Yeah, I mean, to be determined, but there'll be more trials in that area. And also that raises the issue of not people who aren't medical, that have a medical diagnosis. How else can these medicines be used? And there's a study at Hopkins. It was used with meditators, and that's unpublished yet, and that'll be interesting to see. There was a study, a very famous trial in 1962, very famous, called the Good Friday experiment at Marsh Chapel in Boston, where they gave psilocybin to theology students. 10 they got that, 10 got placebo, and 9 out of the 10 who had the psilocybin had this mystical experience as endorsed by those measures, and that was the start of this incredible body of research. Of course, our religious trial leader study, but there's been conversation. How about physicists and astrophysicists and people who are creative? Would it enhance their creativity? How else? There's been talk of giving it to caregivers of people who are dying, to oncologists. There's a very poignant suggestion that could parents. I once had it's a very emotional application. If it comes to pass, I think it will be. A pediatric oncologist had said to me, "I'd like to do a trial with parents of children who are dying of cancer."
I was thinking,
I thought he meant, after they die, the parents have the experience. And maybe what he meant was while the children are alive, because children tell the doctor, as you know, they say, what's really hurting me, painful, is seeing my parents suffering. And so if the parents are able to have an experience that allowed them in some way that's beyond my understanding to move into somehow, accepting is the wrong word, but being with this unfolding of dying, in a way to have them be more present for their child and less racked by such anguish, wouldn't that be a gift for the child and for the parents? So you can imagine, we see so many ideas, and I think each one is more beautiful than the prior. And but again, I want to not get ahead of myself with the audience, and these aren't legal yet, because we get tons of letters. How do I get this, and where do I go? And I'm suffering, and my mother has this, or we're not there yet. We're a few years away. MDMA is probably 2 years away from being rescheduled and illegal. Psilocybin probably 5 years. And it's careful government approved research, making sure it's done properly, with safety and efficacy in mind. But it certainly has the potential to revolutionize how we see healing. But again, I want it behooves us to educate the culture so we don't have the cultural mishap we had 50 years ago when everything went sideways, probably because of the President Nixon shutting everything down. But, that we don't have that kind of backlash. And quickly, you alluded before to the LSD earlier. Probably what we were seeing back then, there were stories of young 20-somethings, teenagers, having psychotic episodes. You heard that what that probably was. So we do know that first break psychosis, as you know, and schizophrenia often occur in the early 20s. And until then, people may have, seem healthy. Then sadly have these first break psychotic episodes, late teens, early 20s. What that's first thing happened back then when these things that were in the press was likely someone who was on track, sadly enough, for that diagnosis, took these psychedelics and probably at high doses and not, of course, not in the proper container or setting, and it kind of facilitated that psychotic episode. We've not seen this cause psychosis in our patients. We do screen out for first generation psychosis and schizophrenia, so people who might have genetic loading are not in these trials. And we do a fair amount of medical and psychiatric exclusionary criteria to ensure safety. And that's what people out there in the world probably aren't doing. And that again behooves, really speaks to the need for doing this a certain way, which, by the way, were done throughout history. Indigenous cultures, the Aztecs and the ancient Greeks and in India and throughout the world, we see these medicines being used, indigenous cultures, for spirituality. They were part of the container, part of a ritual with the village leaders, the shamans, the healers. It was never just taken for kicks. They're not really for kicks. I get why they could be fun, but they're meaning-making molecules. They're meaning-making medicines that cultivates a sense of meaning. And because the great work you do, that meaning has been shown to be a buffer against suffering. Meaning-making seems to be correlated with better coping in this very brief life you have.
Absolutely.
So,
Tony, you're amazing. The work you're doing is absolutely incredible. I'm wondering if there's anything that I didn't ask you that I should have.
No.
I said a lot, and it's amazing.
Yeah, no. It's just look, for the person hearing this for the first time, it's probably a bit bewildering. But just in context, these experiences we seem wired for, they occur naturally. These medicines seem to reliably generate that experience when done in the right way, or other therapeutic experiences that can help people who are suffering, and even maybe gain insight as to who and what we are in consciousness. But again, study as we go. We're in the early stages of this reemergence, and we hope how it might look in 10 years is that these can be tools to treat people who are suffering, and maybe in other ways as well. But there will never be a medicine you go to CVS and just get it. And I hope they're never in a cannabis store down the block. They should only be done in ways where there's trained people in a very regulated setting. And that's a problem for our culture, right, Tracy? Because, we're not great at using, we can't even use alcohol properly, much of the culture. It's sad, right? So we want to see a careful acceptance of these medicines and how they might be incorporated into healthcare and the culture in a serious way.
Well, very well said. And I'm incredibly grateful and honored that you came to talk about this today. I'm super inspired by you and your work. It's incredible to see you. And I also want to make sure I say hi to your beautiful wife, one of my favorite people, the incredible Lauren Fish, an amazing healthcare provider herself, yoga teacher, massage therapist, Reiki healer, and just all around beautiful.
Thank you. The new patient made some good referrals today. This is great. Oh man, I will certainly pass on the warm, the loving regards, and to you too. Your audience knows who you are, but the work you're doing, and even this 1 hour, the way you're present and the way you elicit and are able to bring out these conversations is great, and all the work you do in healing. It's incredible, Tracy. So I'm honored to be in your presence. And happy Thanksgiving. Well, it might not be shown to live. I shouldn't have said that. Is it happy Thanksgiving? It may not be in order.
It might be slightly afterwards, but I'm thankful for you, and I'm thankful for our listeners. This has been another episode of Unpacking Possibility. If you like the podcast, please remember to hit like and share and follow. And until next time, be well.